Assalamualaikum and very good morning. I am Noorana binti Salleh. My matric number 780128075504-001. I am from OUM Kedah Perlis Learning Center. I am here today to talk about what patient needs before surgery. Many people have fear and anxiety about what they have to prepare and get ready before surgery. By giving them some guidance on how to get ready for operation, I will able to educate them in reducing their fear and feeling more calm. The objective of this topic for planning ahead can help ensure patients have successful procedure and heal faster with a smooth recovery. There are several steps patients should take before surgery so that patient feel as relaxed and confident as possible. First one, experienced physician. Patients should know physician about their experience performing the specific procedure that to make sure they are qualified. Number two, anesthesia. Be sure that patient for anesthesia care is led by anesthetic is a medical doctor that specializes in anesthesia for taking care of pain management and critical care medicine. Number three, inform patient to keep healthy before perform the surgery. For example, spend the time before procedure being active and getting good sleep. For those patients smoke vape, use chewing tobacco or use any other tobacco product should stop as soon as possible because smoking can cause problem with breathing during induction. Number 5 is medical bill. How do patients avoid surprise bill? Why healthy and safety is priorities? It is important to make sure insurance coverage is in order before surgery, so patient not receive any unexpected bill. What to expect before surgery? Preparing for surgery and anesthesia checklist. Before the day of surgery, anesthetist will come to patient to gather information that will help determine the right anesthesia care plan. This is important to discuss about medical history, health habit, and past experience with surgery and anesthesia care plan. Health habit. Anesthetists will discuss about chronic health such as asthma, diabetic, lung problem, liver, kidney disease, allergies, or any other medical condition. Be sure to mention if patient have snore or other sleep apnea. This may be symptom of obstruction sleep apnea, which can make surgery or anesthesia more dangerous. To stop recreation drugs such as alcohol, marijuana, narcotic, and stimulant that sustain can affect how reach to anesthesia. Don't forget about experience with anesthesia. Inform anesthetist if patient had a bad reaction to anesthesia or pain medication and make them aware of any anesthesia side effect through experience. It is normal or natural to fear surgery and anesthesia. Surgeon can give information to ease your mind and help patient feel safe. Anesthesia continue to care for patient after surgery. They are more responsible on pain and concern till recovery, returning home and sitting back to your normal routine. Why is pre-op checklist important? The comprehensive pre-operative assessment is one tool that nurses can use to identify, document, and communicate patient risk factor or vulnerabilities. Risk assessment anticipate the potential positive and negative consequences the patient may experience related to anesthesia and surgical procedure. Blood test. Surgeon may tell patient that need some tests before surgery. Some tests are for all surgical patients. Others are done only if you are at risk for certain health conditions. Common tests that your surgeon may ask you to have if you have not had them recently are blood tests such as complete blood count, kidney, liver and blood sugar test. Chest X-ray to check your lung, ECG, electrocardiogram to check your heart. Pre-op checkup. Pre-op is the time before your surgery. It's mean before operation. During this time, patient meet a doctor and doing checkup. Usually need to be done within the month before surgery. This gives your doctor time to time any medical problem you may have before your surgery. Fasting. Doctor has instructed not to eat before the operation. It's important that you don't eat or drink anything. This include light snack, sweet and water. You need an empty stomach during surgery, so you don't vomit while you are under anesthesia. If you take insulin because of diabetic, you are still need to avoid eating and drinking before surgery. But make sure your medical team is aware of your condition so appropriate precaution can be taken. Sometimes a patient may be asked to take an enema the evening before surgery to empty the bowel. Do not wear makeup, deodorant, perfume, cologne or aftershave the day of surgery. Do not wear nail polish. Do not wear contact lens. Leave valuable and jewelry at home. Advise the medical staff at dentures or other prosthetic device you may be wearing. The last point may be an issue if consent is obtained. Upon the day of surgery, most patients will have firmly decided to proceed before attending for surgery. However, a minority may develop doubt upon learning about the procedure in more detail. During the consent process, if this doubt arises on the day of surgery, the patient may feel under duress to proceed, as all arrangements have been made. Therefore, it will be wiser to obtain informed consent at the time of listing in clinic, when the risks and benefits are often explained. The patient will feel under less pressure to proceed and hence will not be acting under duress. Finally, we need to inform patient about post-operative care in the care you receive after a surgical procedure. The type of post-operative care you need depends on the type of surgery you have, as well as health history. It often includes pain management and wound care. Post-operative care begins immediately after surgery. It lasts for the duration of your hospital stay and may continue after being discharged. As part of the post-operative care, healthcare provider should teach about the potential side effect and complication of the procedure. Overall of this topic, people will understand and prepare themselves before come for surgery. Thank you.